Go ahead, Rachel.
Welcome, everyone, and thank you for joining our monthly Hunger, Nutrition, and Health Action Collaborative webinar. I'm Rachel Forensic with the CDC Foundation. The Zoom chat is open, and we welcome you to put your name and your organization if you'd like to introduce yourself. During the panel discussion, we're going to close the Zoom chat, but then we will open it up when we go into our Q&A segment, so that if you'd like to share resources or information, you can do that towards the end. Just a reminder to be nice to each other and to please not post any political commentary or sell any products. At any time during the webinar, you can submit questions for the panel using the Q&A feature. We took a break from our August webinar, and if you missed our July webinar on hunger, nutrition, and health and pregnancy, you can view that recording at impacthunger.org. Let's go ahead and take a moment to find out who's joining us with a short poll. We'll give you just about, 20 seconds. All right, why don't we go ahead and close the poll? A lot of nonprofits, like usual, and some state government agencies. Great, glad to see you all here. So let's go ahead and dive in. I'm going to start today's webinar with a really sobering statistic. 1 in 5 military and veteran families experience food insecurity, rising to 1 in 4 among active duty military families, compared to 1 in 8 U.S. households. That is a stunning statistic. The Military Family Advisory Network is leading the charge to change this. MFAN is a support network for military-connected families. They take a holistic approach to strengthening military family well-being. Since 2017, MFAN has led the charge on identifying, measuring, understanding, and combating food insecurity in military families. While we're going to hear about some unique challenges that military-connected families experience that contribute to food insecurity, I think we're going to see that hunger and food insecurity is a symptom of much broader challenges. Food banks also play an important role in the lives of military families, and we're excited to have a food bank that serves the Tacoma, Washington area called Nourish Pierce County, here to talk about the boots on the ground work they do to support military families in their area. Today I have with me Shannon Razsadin, CEO of MFAN, and Sue Potter, CEO of Nourish Pierce County. Welcome, Shannon and Sue. I'm so glad to have you here for this important conversation.
Thank you so much for having us.
Thank you very much.
Sure. Let's go ahead and dive in. Shannon, I want to start with you. Several parts to this question. MFAN is actually days away from launching a large survey of food insecurity in military families. So first, can you tell us a little bit about the survey and provide any background context about food insecurity in the military? And I also think people will like to hear about or be curious about how issues for military families are the same or different than civilian families. So let me turn it over to you.
Absolutely. And thank you so much for having me here today. So yes, we are just a few days away from launching our Military Family 360. We do a large research effort every other year to really understand the experiences of military and veteran families. Our most recent survey, which was in 2023, had over 10,000 respondents, so the sample size is large. And it allows us to hear from people in a mixed method approach. So what's that mean? Both a combination of quantitative and qualitative questions. And when we first started fielding this research effort, food insecurity was not on our radar, but we started hearing about the issue from an advisory board member who was working down at a food bank in Hampton Roads, and she was seeing a lot of military families come in and seek support. So we moved forward and we started adding the USDA 6-item short form food security scale in the research, and we did find that there was a significant number of respondents who were facing food insecurity. So fast forward, that finding has since been replicated by the Department of Defense in their status of forces survey. And now where we are is really how do we make sure that we're getting left of food insecurity? So we interviewed more than 300 food insecure households, and we found that there were 4 common things that were happening in people's lives that bring them to the point of food insecurity. One was a recent move. 2, military spouse unemployment that has sat at around 24% for the last 15 or so years. 3, a growing family. And then 4, an unexpected hit to the budget. And so when you hear those things, there are a lot of similarities between the military and civilian populations. We know that the military is a microcosm of the broader population. However, some of those experiences, especially the frequent moves, is a pain point for military families. And we found in our research that 51% of our respondents who had moved in the last 24 months were experiencing food insecurity. And so now where we are is really working to combat some of the challenges that families are experiencing as it relates to that frequency of moves and really partnering with awesome organizations. I see a few of our partners here today, like Armed Services YMCA and Combined Arms, and Sue and her team have been unbelievable partners in this work as well. Because at the end of the day, families don't care who they get the support from. They care they get the support that they need. And so we really believe in that collaboration. And yeah, just thank you for having me. I'm happy to share more about some of the discrete populations where we see more prevalence. But yeah, thank you.
Thanks, Shannon. That's super helpful. I actually want to just continue that thread for 1 minute. Are there certain demographics in the military, like younger families or certain ranks or racial demographics that are at greater risk? Can you say anything about what you know?
Yeah, so we see the highest frequency of food insecurity among junior and middle enlisted with children, so families. And what we're often seeing is that the military spouse is the one who is going without food or cutting back on the food they are eating. 90% of military spouses are female. And we're seeing that they are making sure the service members and the kiddos are fed and then, putting themselves on the back burner. And when we think about the support that military families lean on, one of them is an amazing one, WIC, which we all know about, but we also know that WIC is a state-run program. And when you're moving, it can create a gap in that support for families who are really counting on it when you're moving across state lines. And so, short answer, junior and middle enlisted with families are the ones that we're seeing the highest frequency of food insecurity with.
Great. Thank you for providing more detail on that. Let's turn to hear a little bit about work that's happening at the local level. Sue, can you tell us about your partnership with MFAN? What role can local food banks play that MFAN cannot in reaching military families? And how did your partnership accelerate your work at the community level?
Well, we were very fortunate that MFAN found us, number one, because we had been trying to find unique ways to support our military here in Pierce County, Washington, for many, many years, with very little opportunity to really talk to base command about it. So what my organization did is just surround the base with food pantries, taking the food to where the people are. But our partnership with MFAN accelerated everything. It was really powerful because they brought the national research and credibility to the table, while Nourish brought the local presence and trust of the community. MFAN could highlight the scope of food insecurity among military families, like Shannon just shared with us. Here in Pierce County, there's another factor with the cost of living here. It's so high. We're just south of Seattle, so that might give you an idea. But as a food bank, we could put our boots on the ground, meet the families face to face, and get the food directly into their hands. And that combination of MFAN's research and credibility, our ability to get into the community, gave us that hard data and the stories we needed that accelerated our messaging. And we were able to engage local leaders, legislators, and even local and state federal legislators, and even base command in a way that we couldn't have done alone without MFAN's partnership.
That's fantastic. That is that's really powerful. And thank you for highlighting the differences that you all brought that were really complementary. Let's keep going. And I have a question I want to ask both of you, and that is, what unique challenges do military-focused partnerships face? And how can the culture of pride and resilience in the military impact barriers to serve families who might be reluctant to seek help? Either one of you want to start that?
I can go ahead first, and then so we can kind of riff off each other. So
Sure.
the military, there are some nuanced experiences that military families and service members have, and one is the added consequentiality around your financial health. And so if you are struggling financially, that could put you in a situation of vulnerability as it relates to security clearance, for example. And so we often see that military families are struggling with hardships quietly, or they're trying to just get by, just get by, just get by. And it can make it harder for people to ask for support, and make it harder for other organizations to really know who's military connected in their local communities. And I think that one of the things that we've seen is often just asking people if they need help in a certain area opens up a door to say, like, okay, you get me, you understand what I might be going through, and now I don't have to ask for that specific support. And so we've seen when organizations like Nourish do a great job of asking those questions and showing that you get it from a cultural competency, it makes a huge difference in lowering the barrier to entry, because the military is a very proud community. And we know that, and rightfully so. But that pride can really get in the way of asking for help when people need it.
Yeah, riffing off of what Shannon said, one of the biggest challenges that Nourish has faced, Joint Base Lewis McChord is the largest employer in our county, and so our neighbors are the military and the veterans here. But the biggest challenge on military-focused partnerships is stigma. There's a strong culture of pride here and resiliency in our military, and that can make both base leadership and families hesitant to ask or accept help. And at Joint Base Lewis McChord, we saw that, we still see it very firsthand. But what really has helped is when trusted partners and fellow military families show that it's okay to accept support. That resilience shifts into action, and families see that getting help isn't a weakness, but it's a way to stay strong for each other. So the way we've been able to create those inroads and sort of try to get rid of that stigma is really working with the military families that have been approaching us and asking us to come on base, asking us for help, and then incorporating them into our advocacy work, because that shift from resilience into action really does bridge that stigma.
That's really powerful. And I loved the way you put it, seeing it as staying strong for each other, not as a weakness.
That's the secret sauce.
It is. And it's also, we've got to look at it from the perspective of, this issue does not exist in a vacuum, right? When you're experiencing food insecurity, we know that it impacts so many other parts of your life. And for the military community, it actually impacts your readiness. And so if a service member is deployed or is focusing on a training exercise, and they're worried about their spouse and their kids having enough access to food at home, that is a real distraction from the mission that they have to focus on for really our national security. And so that consequentiality is important. But you know, there's also the mentality in the military of you don't leave anyone behind, right? And so
Yeah.
it's being able to offer that support to help people connect into those resources. And we've seen that with the acknowledgement that yes, 24% are experiencing food insecurity, it has made it a little bit easier for people to ask for help because they know they're not alone. They know it's not their fault. They know that it's a complicated issue. And oftentimes people find themselves on a just getting by, just getting by, just getting by, and then something happens. And so that acknowledgement has gone a long way in reducing the stigma. We still have a ways to go for sure, but we are making progress there.
Yeah, that's great. And yes, and having military families there to help military families. I
Yep.
love that. They're really important. Awesome. Sue, what advice would you give to community organizations hoping to better engage with and support military families experiencing food insecurity in their communities?
It's such a good question. And I want to recognize that there's people in our audience that probably have had really innovative and more successful ways to do this than Nourish has. But I can speak with our relationship with Joint Base Lewis McChord. We've been trying to work with them for over 10 years and really not getting anywhere. So we pivot. We have to be flexible. And our way to immediately pivot was just to surround the base with food. So you do what you can and you partner with who you can just to feed people. But originally, our goal was to get on base, to have a food bank on base. We didn't care if we branded it. We didn't care what we had to do. We wanted to get food to our soldiers and their families. But we failed. We failed. But we advocated and we were a squeaky wheel. And what has ended up happening and is in progress now is that the base talked to us, but then decided to approach the Armed Services YMCA and offered them an opportunity to open a food bank on base. They called us and said, help, we don't know what we're doing. So my answer, what advice would I give to better engage? Build benevolent partnerships. Partner with other nonprofits that are in the position to feed military families, whether your organization is in that position or not. Because by us partnering with the YMCA, we are able to pool our resources. We've shared our expertise. We've had them out looking at our distribution model, of our volunteer model, and shopping models, so that everything we do is done with compassion, dignity, and respect. We've sent our operations team out to help them design their space. We've provided them with equipment. We've introduced them to potential food partners, and actually kind of behind the scenes, we help them get some funding and some equipment to help them start up. It's not the food world, as some of you out there might know, in Washington State, it is a deterrent to partner benevolently with other organizations because our funding and our food is based on how many people we serve. But we have tried so long to serve our partners in the military, we had to forget about counting the numbers for Nourish. Our goal was to feed the men and women who serve our country. So side by side, we built this relationship. It goes beyond transactional collaboration. We're fostering a relationship with the Armed Services YMCA built on generosity, trust, and shared purpose. Basically building generosity without a real agenda other than we gotta feed these people. So we're offering our support and sharing opportunities with them so that we can meet the mission of ending food insecurity at Joint Base Lewis McChord. So my advice is be flexible and be benevolent. Find others who you can partner with just to get the food to the people who need it, because everybody deserves food.
Yeah.
I hope that answers your question.
It sure does. And I know you're not doing it for this reason, but I really believe that your generosity is it's going to come back to you.
You know, we're doing it because people need to eat, and what
Yeah.
happens. We're just so thrilled that the YMCA has this opportunity, and it's in our best interest to help them succeed. So we'll do what we have to do to help them succeed.
That's awesome. Great. I want to remind folks to please don't be shy about putting your questions into the Q&A. I do have a question that's a bit technical, and either of you can answer it. Shannon, I think we were talking about this the other day a little bit, and I think I don't know if you can unpack this for folks. Can you explain how SNAP and WIC are federal benefits and can be considered an extension of their military pay? How does basic housing allowance, how is that considered in WIC and SNAP applications?
It's a great question, and it leads to a lot of confusion. And so for WIC, the eligibility does not factor in the basic allowance for housing as income. So
Okay.
when we look at that, more military families are eligible for WIC than they are for SNAP, because SNAP does factor in that basic allowance for housing in the equation for eligibility. And so oftentimes people, military families are like, oh, well, I wasn't eligible for SNAP, so I'm not going to be eligible for WIC. And that's a misnomer, right? Apply, see if you can be eligible for WIC, because there are different qualifications for that. And it's something that from an advocacy perspective, several of our organizations have been working on to really think through if we can get to the point of that basic allowance for housing not being factored in as income. But in the meantime, really encouraging people to enroll for WIC and get the support that they need at the community level.
Great. Thank you for clarifying that. Doesn't seem like they're both federal. Well, WIC is run at the state level.
State level. Yep.
Right.
Yeah.
Got it. Thank you for clarifying that for folks. I don't see any other questions yet, so I want to ask you one more question that I have, and that is, what would you like our audience to know and or do differently after listening to this conversation today?
Sue, do you want to start?
Yeah, I just would like to, in regards to SNAP and WIC, I think it's really important that if you're in a military community, that we do everything we can to educate military families that SNAP and WIC are two independent programs, and that WIC is still available. And on the same hand, we've had a lot of success here advocating in partnership with our congressional delegation around working with the Pentagon on trying to get the housing allowance out of the SNAP calculation. And I just would encourage anybody who has the bandwidth and advocacy to really work with your local delegation and see if they can get on board and help to ring that bell, if you will, on the advocacy front, because people are starting to listen, and they do understand that that housing allowance is keeping our military, at risk because they're hungry. So anything you could do on the advocacy front.
Yeah, I want to do that. And I think that also just not making assumptions. I think one of the things that surprises people most when I'm talking about this issue is, wait a second, they're serving in the military, they're food insecure. Like, don't we take care of, as a government, all of their basic needs? And the reality is that the compensation package for service members was really thought about at a time when America didn't require dual income households to really achieve financial stability. And that's the reality that we're in right now. But when you're moving and on that hamster wheel of every 27 months, you're changing to a different location, that often means leaving a job behind for the spouse. And so you're relying on that one income. And so it's a complicated issue. And I think just offering the support, or offering, there's this great, resource that's down the street, you might want to think about it, and just approaching it in a way that's not a haves versus have-nots, but informing people of the resources that are available to them to really help combat that stigma as well.
Shannon, can you say any, just tell us when will you have results from the survey that's launching, and then what will you do with them? And then I have one more question from our audience.
Yeah. So we will be releasing our findings in May. And so if anyone here serves military family members or veteran family members, please do encourage them to take this survey. It is very important to us. We have 2 PhD responders read every single response. And so it's something that takes a significant amount of time, but the time is so valuable for us and really learning what's happening in people's lives. And we're going to bring those findings, one, back to any organization who wants to work with us to address food insecurity and issues more broadly, but also we'll be hitting the ground on the hill and really making sure that people in decision-making roles have access to that new information so that we can meet people and the needs that they have.
Awesome, thank you. The last question I have is around, are you doing anything, thinking about working in supporting military families through the use of medical nutrition therapy? They mentioned this therapy promotes lifestyle changes that can help with stretching foods, incorporating nutritious and filling foods, and achieving long-term food security. Anything you could comment on that?
Go ahead, Sue.
Okay. I know from the food bank standpoint, our focus is on social determinants of health, which obviously food is one. So we focus on nutritious food, and then we also partner with organizations, hospitals, the health department to provide nutrition education classes, recipes, shopping guides, food tastings, much like you'd see in a large retail store, and sometimes month-long nutrition education classes that people come to for free. It's all free of charge because food is health. I mean, when they say you are what you eat, you really are what you eat. So we call it something a little different, but it achieves the same outcome in many ways. And here in Pierce County, we're very, very culturally diverse. So our organization has made a really big effort to make sure that every location we operate has food that is culturally and religiously relevant. So anytime you visit a Nourish food pantry, you're going to find healthy foods that taste like home, no matter where home is to you. So that's how we're doing it with boots on the ground in our community, if that helps.
Yeah, and I'll just piggyback on that. From a legislative perspective, there actually is language in the National Defense Authorization Act to look at food as medicine and how nutrition plays a role here. And what we're seeing happen on the base level is really a concerted effort to make sure that the food that's being served is healthier, is more nutritious for the service members. But then also we have to think about from the perspective of readiness. And one of the biggest challenges the military is experiencing in the recruitment is obesity and combating obesity. And so we know that healthy food piece is so important. And again, it has that ripple effect that just hits a little bit different in the military space.
Thank you. We are almost at time. One of the things we always ask our audience, if they're willing, is to put in the chat and tell us if there's one thing that they're going to do this week because of what they learned today. Anything different or new that they might do because of what they learned today. So we hope our audience will go ahead and put that into the chat. We appreciate it. First of all, let me thank you, Sue and Shannon. You've taught me so much about this subject in leading up to the webinar as well as today. I keep thinking about the 4 real impacts that affect food insecurity, and while they are more pronounced in military families, they really are issues that would affect any family, right? Like if you have to move. If you have someone in your family, your spouse is unemployed, loses their job as a family grows, and some kind of major problem like, a car breaks down and, anything, you have another family member that needs support. So I just think those are factors that hit so many families, but I understand the real the severity that it's happening more often in military families. And I just really, you all have highlighted so well today how local and and national partnerships really can play well together, play off of each other. You know, Shannon, your group having the research and the credibility, and Sue, your real knowledge and experience in the community makes such a big difference. So I love it. That's exactly what we're about, is highlighting those kind of partnerships. So thank you. Thank you so much. Want to remind folks that our next webinar will be on October 15th. So same time, there'll be a place to register on our website, impacthunger.org. And when you are ready to log off here, a survey will pop up and you can take that and tell us a little bit about how this webinar was so we can continue to improve. So I hope everyone has a fabulous day. We look forward to our next webinar, but also hate to see this one end. So again, thank you so much, Sue and Shannon.
Thank you.
Thank you.
Thank you. Take care. Bye-bye, everyone.